More lawmakers are joining the fight against prescription drug abuse. U.S. Senator Kirsten Gillibrand and Congresswoman Louise Slaughter are backing a bipartisan bill aimed at preventing overprescription of opioids. Jordan Guerin joins us now with how this bill would work. Jordan?
Well, Adam, what's being called for is a set of guidelines by the CDC when it comes to prescribing painkillers. Lawmakers are saying opioid abuse is becoming an epidemic and that doctors are part of the problem.
We're feeding a disease that everyone wants to ignore and not call a disease.
Each day, 51 Americans die because of an overdose from prescription opioids. Many who abuse these painkillers, like Oxycontin, eventually turn to heroin. It's a problem now getting national attention.
We have to give doctors guidance about how much will make someone addicted. Are there alternatives that are non-addictive? And don't give someone 60 pills when they only need 3.
Senator Kirsten Gillibrand recently introduced the Preventing Overprescribing for Pain Act to the Senate. It calls for new guidelines focusing on prescription treatment for acute pain. Gillibrand and Congresswoman Louise Slaughter both say many doctors overprescribe, but they add the problem doesn't start there.
And that's certainly a good place to start. But the doctors have to cooperate. But the pharmaceutical companies, you know what they want. They want to sell as much as they can, as high a price as they can.
The guidelines called for are just that, guidelines. They wouldn't be binding.
It also serves as a reminder to be careful when we're writing prescriptions. It's really important. So I think this is a great start.
It's education for our providers to really follow guidelines and to show that this is what we call standard of care. So when providers are practicing outside of these guidelines, which then become deemed standard of care, there should be some accountability to that.
So just to give you some perspective of this actual problem here, Trillium Health says locally they've seen a 60% increase in admissions for opioid addiction over the last 10 years. Chief Medical Officer there, Dr. Birnbaum, says if no action is taken now, the issue is only going to get worse. Adam?
Jordan.